Mrs. Phillips. I'm gonna knock on the door, introduce myself. Hi, Mrs. Phillips. I'm Bailey. I'm gonna be your nurse today, and I'm just gonna be doing an assessment on you, see what's going on with you. Close the door, and then I'd wash my hands. I'm first gonna start out with my QSIN. So I'm gonna check your ID. Can you tell me your name and date of birth? All right. Check your ID band. We've got the correct staff name on the whiteboard. You're not on any oxygen. You don't have any feeding tubes. No abdominal wounds or drains. No chest tubes. You don't have a trach. You don't have a catheter in. You don't currently yet have a IV in, but you will later. Side rails, you've got 2 side rails, beds in low position, call lights in reach, no obstacles or clutter. Patient's assistive devices are near them, water pitcher and cup, don't need a urinal because you're female, and then your commode is on the side and it is empty, and trash bag is attached to the bedside table. Alright. Okay, so now I'm going to go ahead and do my head to toe assessment on you, Mrs. Phillips, and we're going to see what's going on here. Alright. I'm going to look at your eyes real quick. Can you follow my finger for me? Okay. Check your face symmetry. Everything looks fine. No. I'm going to go ahead and take your vitals. So I'm going to take your blood pressure. I'm going to take your pulses bilaterally and check your respirations. Okay, and then I'll make sure I feel your skin temperature, know what it looks like or what I see. Okay, and now I'm going to go ahead. Are you in any kind of pain today? All right. I'm going to go ahead and then listen to your lung sounds, and I'm going to listen to your heart sounds. Okay, I'll listen to the back. Okay, and I'm going to have you lift up your left arm. And then your right. Alright, and then I'm going to go ahead and listen to that heart sound. Alright. Are you having any pain in your arms or your upper extremities or any kind of tingling or anything that I should know about? Okay, I'm going to want you to pull away from me, push towards me, wiggle your fingers, and I'm going to check your cap refill. Okay, and then I'm also going to check your skin turgor. Alright. I don't know any edema in your hands or in your wrists or anything, so that's good. Also, can you tell me where you're at today and the month, day, or year? Okay. And are you having any pain in your abdomen or anything? Okay, I'm going to look up your shirt. I'm just going to look at it. Okay. I'm going to go ahead and listen to it. Are you passing gas? And okay, do you know your last bowel movement? Right. So I'm going to go ahead and just listen to that in the 4 quadrants. Alright, everything sounds good. I'm going to go ahead and feel around for any tenderness. Alright. Are you having any problems going to the bathroom or anything? Any burning or frequency or any discharge that you notice when you go? All right. And then I'm going to go ahead and check out your legs. I'm going to look for any edema. Are you having any pain or tingling in your legs? How about in your feet? No? All right. So legs look good. I'm going to check your feet. Okay, push towards me. Pull away from me. Wiggle your toes. I'm going to check your cap refill. I'm going to check your pedal pulses. All right. Alrighty, so what I did find with you, Mrs. Phillips, your blood pressure was at 216/108, your heart rate was at 92, your respirations were 20, your temperature was 36.9, your pulse ox is at 96% on room air, you weigh 107 kilograms, and your height is 162 centimeters. Now, some of the things, or also, your respirations, they sounded good, they were clear, or your lung sound sounded good, they were all clear, your respirations were unlabored, your pulses were +2, bilaterally, I heard your S1 and S2 sounds, there was no extra sounds, you did state though that you had a headache of 7 out of 10, and it was persistent without any, even with taking the acetaminophen. Okay. So some of the things that I would see too with hypertension, the signs and symptoms, they may not have any. That may just, the only sign and symptom may be that they have high blood pressure, but it can, the worse the hypertension gets, you can develop more symptoms. They can have eye changes, they can have an angina attack, heart failure, severe headache, fatigue or confusion, chest pain, short of breath, irregular heartbeat, or blood in the urine. And the assessments that I would have wanted to check out specifically would have been like their blood pressure, their intake and output, heart rate, neurostatus, their pain and their vision, heart sounds, lung sounds, pulses, and edema. Okay. All right, and a couple of things to Mrs. Phillips that before you get discharged would be that you can, to help with your hypertension, you need to watch your diet. So decrease your saturated fats or your total fats, eat low-fat dairy, fruits and vegetables, you want to exercise, don't smoke, decrease any stress that you have, you want to decrease your caffeine intake, and you want to lose weight. You were a little bit, you were a little bit on the heavier side, for your height, so you would want to maybe lose a little weight, because even 10 pounds can make a difference in your blood pressure. So just, the risk factors for you would just be obesity, if you don't exercise, if you haven't increased in your fat, cholesterol, or intake, and if you have, eat a lot of sodium. Alright, so I'm reporting off to my nurse now. I'm going to tell her, this is Mrs. Phillips, she's a 43-year-old female, she came into the emergency department, had really bad headache, wasn't relieved by it. She took 1,000 milligrams acetaminophen, it wasn't relieved. She's had it happen 3 hours ago. She is blurred vision, and she doesn't have any past medical history. And with further assessing, they found her lung sounds are clear, +2, pulses bilaterally in pedal and radial, S1 and S2 sounds heard, they were all normal. Vital signs, blood pressure was 216/108, heart rate was at 92, respirations were at 20, temperature is 36.9, she weighs 107 kilograms, height was at 162 centimeters, and her pulse ox is at 96% room air. So then they ordered a CBC, BMP, BNT, a CT scan of her head, chest x-rays. They ordered to insert 2 large bore IVs, nasal cannula to keep her pulse ox more than 92. Give her metoprolol, 5 milligrams IV push, 1 dose now. Hydralazine, 10 milligrams IV push as needed every hour if her systolic is over 200, and the morphine 2 milligrams PRN every 4 hours for her pain. So I gave her 2 large bore IVs and sent off blood work. Administered her 5 milligrams of metoprolol over slow IV push. Put her on a cardiac monitor. She's still complaining of that 7 out of 10 headache pain, so I gave her 2 milligrams of morphine IV push. Came back. Her blood pressure was at 204 over 102. Her pain was still at a 7 out of 10. Heart rate was at 86. Room air was at 94%. Her pulse ox was at 94% on room air, and her respirations were at 14. Then her labs came back too. Glucose was at 193. Her hemoglobin A1C was at 9.2%, and her BMP was at 160. So then afterwards, we gave her hydralazine, 10 milligrams. Her blood pressure went up to 218 over 110. Her heart rate then went up to 104. So they took her to the ICU. They were going to initiate the 2.5 milligrams of nicardipine. So then after she came to the ICU shortly after, she couldn't speak, couldn't lift her right side, or her right side of the face was drooping, and she couldn't lift her right arm. Her blood pressure was at 208 over 112. Heart rate was at 110. Pulse ox was at 92%. So then they took her to the OR, evacuated a large subarachnoid hematoma around the brain. I let her family know about it, that she's having hemorrhagic stroke. Then 2 days after the ICU, she recovered all her movement, arms, speech, and facial symmetry. It's all normal. They transitioned her from her IV meds to PO, metoprolol, amlodipine, hydrochlorothiazide, and she's doing good with those. Her blood pressure is averaging 140 over 150 systolic now, and she says she doesn't get yearly checkups, and she's being discharged tomorrow. I just gave her I educated her while she was here on her diets, things that she should eat, exercising, she shouldn't smoke, with drinking only 1 glass of beer or wine, decrease her caffeine, all that, and then just letting her know what she needs to know before she goes home with her blood pressure and symptoms and all that.